Muscle Doctor, it's Liam here, and today we're going to take a look at the muscles of the lower limb. So let's dive straight in and look at the biggest muscle fiber for fiber in the human body, gluteus maximus. So the biggest muscle of the three gluteals, glute max has a strong origin at the sacrum, coccyx, iliac crest, and inserts down into a couple of insertion points, but the one we're going to take point of here is the iliotibial tract. So it actually inserts into the IT band along with another muscle, tensor fascia lata, which we'll get to in a moment. So glute max being at the back of the body, muscles only shorten. As it contracts, it's going to bring the hip backwards into extension. It's also going to abduct and laterally rotate the hip. If we remove that layer, we've got some other muscles underneath. Lots going on in here. We've got gluteus medius just up in the top corner of the hip. So this muscle primarily abducts and medially rotates the hip, but actually it kind of does everything. We call it the deltoid of the hip because its anterior fibers flex and medially rotate, the posterior fibers extend and laterally rotate, and the mid fibers abduct. So it does a bit of everything. Underneath that, we've got gluteus minimus, which is just down there but not insignificant. A good way to remember the actions of glute min is that it has exactly the same actions as the TFL muscle that we mentioned earlier on, which are flexion, abduction, and medial rotation of the hip. And by taking a look at the anatomy and where it is, you can kind of work out abduction. But this also then forms the origin or one of the two origins for the IT band. Interestingly, TFL does almost the opposite of glute max. So whereas glute max extends the hip, TFL flexes. Where TFL medially rotates the hip, glute max laterally rotates. So an antagonist almost in every sense, but we do need a good amount of balance between the two muscles for optimum tension in the ITB. So the IT band or the iliotibial tract, its job is to stabilize the lateral knee, so it does need to be tight to a degree. Any excess tension in that is going to be determined by TFL or glute max, its two origins. So as we move round to the anterior upper leg now, we're actually going to take a look around the hip, and we've got these two muscles just poking out there. The psoas major and iliacus are just inside that kind of inguinal space. These both flex the hip, as you would guess with them being on the front, but that isn't where they end. The two combine together into the iliopsoas, which is just a common tendon, and insert onto the lesser trochanter of the femur. If we continue to strip those layers back and look into the abdomen, we'll see that psoas major particularly is actually quite a large muscle. It's not just a hip flexor, it's also a core and lumbar spine stabilizer through its really quite large origin around the lumbar spine, transverse processes and bodies of the lumbar vertebrae. Further down the anterior leg, we're going to build those layers back up before stripping them away again, and we've got the longest muscle in the body, sartorius. So sartorius originates at the ASIS on the ilium, comes all the way down, wraps around the inside of the leg, and inserts a very interesting insertion point. We call this the pezanserine or pezanserrinus. Pezanserine means goose's foot in Latin, and geese have 3 toes, and those toes are represented by the 3 muscles that insert into that tendon. We also refer to those as the Sargent group. Sargent abbreviated to SGT. S, sartorius, G, gracilis, and T, the tendinosis of semitendinosus. Now the interesting thing about those 3 muscles is that they all come from the 3 different bones of the pelvis, with sartorius originating at the ilium, gracilis originating at the pubis, and semitendinosus originating at the ischial tuberosity. Let's take some layers off then, and we can see rectus femoris. So rectus femoris, one of the 4 muscles of the quadricep group. What separates this from its fellows is its origin above the hip. So this actually comes just below sartorius from the AIIS, the anterior inferior iliac spine. Because it crosses the hip, it must act on the hip. It's at the front of the body, so it's going to bring insertion closer to origin into hip flexion. It inserts at the same place as the other 3 quadriceps group, which is into the quadricep tendon, but it doesn't stop there. Over the top of the patella, into the patella tendon, and then onto the tibial tuberosity, just there at the top of the shin. So the other quadriceps that we've got there can be defined as the vastus group. Vast because they're big, they cover a vast amount of space. Underneath rectus femoris, there's vastus intermedius because it's in the middle of the other 2 heads. On the inside, we've got vastus medialis, which is often referred to as the teardrop muscle of the quad because it can look like that when it's got skin on top. The third and final is vastus lateralis. So the biggest of the three is the outer quad, sits on the lateral side. And interestingly, as we add the layers back on, you'll see that the iliotibial tract covers vastus lateralis, and that muscle sits directly underneath. You can see it poking out the back of the iliotibial tract. So don't forget that when you're doing some work into the IT band, vastus lateralis is underneath, which might be one case for indicating work on the iliotibial band itself. As we come medially, we're going to have to start to strip some layers off again, but before we do, we've got one of the longest muscles in the body. We've got gracilis, certainly the longest of the adductor muscles. It crosses the hip and the knee. Adducts the hip, flexes the knee, along with the two others in the sergeant group. Let's remove some layers, and we've got some more adductors in there. We've got adductor longus. If there's a longus, there's going to be a brevis. So brevis is in there as well. And then somewhere deep down, we've got adductor minimus as well, which again is vestigial. Not everybody's got one. Pectineus, one of the shorter hip adductors. And one of the largest in there is the adductor magnus. As illustrated by the name, it's magnificently big. This is called the fourth hamstring because of its shared origin with the hamstring muscles of the ischial tuberosity just around here. Let's remove those hamstrings just to see exactly how big it is. It's in there and it's fairly large, but it is tucked away underneath the hamstrings, so don't forget about it when you are targeting the hamstrings. Adding those layers back on, and we can see the hamstring group. So they all originate at the ischial tuberosity into one common tendon. Interestingly about the hamstring group, we've got three muscles in that group. Biceps femoris on the lateral side. So with the most lateral muscle, its insertion as it crosses the knee, because it flexes the knee, inserts onto the head of the fibula. If you look at the mass of the biceps femoris, it's about 1/3 of the hamstrings group. The other 2/3 is comprised of the medial muscles. So we've got semitendinosus, which we've discussed, and semimembranosus as well. These insert onto the tibia, which, as fits with the theme, is roughly 2/3 the size of the lower leg. So we've got 1/3 the musculature onto 1/3 of the bony space, the fibula, and then we've got 2/3 of the upper leg musculature onto the 2/3 of the bony space of the lower leg, being the tibia. So we mustn't forget, before we move on down below the knee, about the deep lateral rotators of the hip. So I often refer to these as the rotator cuff of the hip, because they work in a similar way where they stabilize the hip in all kinds of different movements. They laterally rotate as indicated by the name, and there are 6 of them. We've got piriformis, which is probably the most well known. In a certain percentage of the population, figures vary, the sciatic nerve actually passes directly through this muscle. So sciatica could be being caused by a type piriformis, possibly, pending assessment. Let's move further down the leg and have a look at the knee. So in the back of the knee space here, we've got a few deep muscles, the first being the popliteus. So we call this the popliteal space. And in there is the popliteus. It's a weak flexor of the knee. It's a stabilizer of the posterior knee, but it also plays a role in unlocking a fully extended knee. We add the layers back on and we've got plantaris, another vestigial muscle. Not everybody's got one of these. A relatively small muscle belly for a comparatively large tendon. And this tendon comes down into the calcaneus via the Achilles tendon. And that is the insertion point for many other plantar flexors of the ankle. We've got 8 plantar flexors of the ankle. Compare that to the dorsiflexors, where we've only got 3, and you can see the need for plantar flexion and strength in that movement to propel us forward and up. Let's have some more layers back on, and we'll begin with the gastrocnemius. So when you think calf, this is probably what you picture. This is what you can see. It's the most superficial of all the calf muscles. It's the strongest plantar flexor of the ankle, but it also crosses the knee, so it flexes the knee as well. We've got the medial head, and we've got the lateral head. They both insert into a very strong muscular tendinous junction down into the Achilles or calcaneal tendon. They share that insertion with the soleus. Soleus, not to be forgotten about, is bigger than a lot of people think, but it sits deep to gastrocnemius, so it can be forgotten about. It doesn't cross the knee, so it doesn't act on the knee. It doesn't flex it, it just plantar flexes the ankle. So if we want to really isolate soleus, we flex the knee, taking gastrocnemius out of the movement so we can focus on that muscle, either in treatment or assessment. Let's remove the soleus, and we've got 2 relatively surprising muscles. flexor digitorum longus. So flexor, it flexes the digits of the foot, so it curls your toes. And as we take a look underneath the foot, you'll see this come round, switch sides onto the toes. On the opposite side, we've got flexor hallucis longus, so it flexes the hallux, i.e. big toe. This again switches sides and comes onto the big toe. These two, combined with tibialis posterior, which is the deepest of the lower leg posterior musculature, can be remembered in the way their tendons come from the medial malleolus just down here. So we call these three tendons together Tom, Dick and Harry, with Tom being tibialis posterior, Dick being flexor digitorum longus, and Harry being flexor hallucis longus. They sit in that order from the medial malleolus down to the calcaneus. Onto the lateral side, and we've got the peroneals. So peroneal longus or fibularis longus. We've also got peroneus brevis or fibularis brevis. Fibularis makes more sense and is probably more widely recognized, easier to remember because they connect to the fibula. These two muscles being on the lateral side of the ankle, evert the ankle and being the only muscles to do so. Let's take a look at fibularis longus, because that muscle roots via a tendon all the way under the foot and gives some structure to the arch of the foot and inserts onto the base of the first metatarsal and the medial cuneiform. So it shares an insertion point with tibialis posterior, which is just around the front. And we've seen how TFL and glute max can insert into the IT band, two effectively antagonists to each other, providing equal and opposite balance to a structure such as the IT band. Tibialis anterior around the front doing very different things to peroneus longus almost in every single way. Inserting into the same point, also providing some stability for the arch of the foot. So those two are related through antagonistic properties. Other muscles around the anterior aspect, we've got extensor hallucis longus, clues in the name, extends the hallux or big toe, and then extensor digitorum longus. Again, a much bigger muscle belly than you might imagine. Tibialis anterior doesn't make up the bulk of the musculature at the front of the shin. We've also got at least one half of that being covered with extensor digitorum longus. From there we go down into the base of the foot, and we're taking a look at the sole of the foot or the plantar surface, and we've got a lot of muscles in there, many of which we're not going to cover today. That would be a lot more in-depth look at the foot itself. But one point I'm just going to make note of here is this common insertion point of the flexor tendons around the anterior calcaneus. So the reason I mention that point there is because irritation or inflammation of those tendons can give us what's known as plantar fasciitis. Often people will feel the pain directly in this spot, and it will probably hurt when they wake up first thing in the morning most of all. We just strengthen those tendons if we're going to get away from pain in that area and escape the clutches of plantar fasciitis. So that's a fairly brief overview of the muscles of the lower leg. I really hope you found it helpful and that you can use it in a constructive way. I would love for you to engage with the video. Please like, subscribe, comment. Let me know any requests of videos that you'd like to see, and I would love to make them for you. Bye for now. Thanks for watching.